I think we're live. Okay, we are live. I was sitting there. I was like waiting for something. Oh my God, we've been doing on this platform for forever, and I'm still not used to like it just going.
It's different. I feel like it's different each morning.
I am asleep still, and that's my bad. I was actually telling Carrie about how I think my house has a poltergeist. Like, in the most...
Possibly haunted.
It's possibly haunted. And the most, what am I trying to say, like, cheesy or, like, in the most, like, movie-style way, my husband and I have, like, a giant wooden like, metal cross. It's, like, 7 or 8 pound decoration that flew off my wall this morning at 3 a.m. And so I haven't slept since, obviously.
You should have... You need to tell us what happens tonight.
I will. Well, here's the thing. My husband's supposed to be out of town.
Did he hang it back up on the wall?
No.
Oh, no.
I wouldn't let him.
He's going out of town.
He's out of town this weekend. So I'm like, well, I'm not going to be there. So that's a whole thing. Anyways, so that's what I was telling Carrie about is just my experience of like, so like, do you know any good like, exorcism places?
Nope. I don't like that word.
How do you get that? How do you, I need a guy. So anyways, guys, welcome. I'm trying to get my text to pull up. Welcome to the Medicare Cafe.
It's on there.
That's how you can communicate with us. You can either go ahead and chat on us with our line, or you can shoot us a text message and we will read that as well. But this was actually I'm really excited about today's topic. Today we are going to be talking about Medicare nuances. And I love this topic.
All the weird stuff. Hey, perfect timing for the
all the weird things.
The ghosts.
Oh my gosh, casual.
Perfect timing.
Hell of a segue there. Yeah. Hell of a transition. But this was actually something that you mentioned, saying like because you had like I get these questions all the time. I get these situations, and like and I remember talking like, but how do we make that into like a cohesive training?
Yeah. So today just might not be that cohesive, or it might be.
It's nuances.
We'll be all over the board.
We nailed it.
Yeah.
It's nuances. It still counts. So again, guys, we want this to be really, really interactive. So if you have questions, comments, concerns, threats, or promises, shoot us a text or write it in the comment section. Also, if you've experienced any of these things or like have any crazy things to talk about, let us know. Whenever I do a Medicare 101, what I always do, and my Medicare 101s are always agent-facing. I don't do anything consumer-facing, or I haven't in years. I used to teach a class at the university with Dan Mankus about veterans and Medicare, stuff like that. So that was fun.
Okay.
But anyways, the one thing I always start off any training with is saying Medicare has a million rules
and a million exceptions.
Yep. We all go back to like 1 + 1 = fish. That's Medicare for you.
That's Medicare.
And so that's why like we tell our teams whenever you're doing something, don't ever memorize an answer
because it's going to change.
Because it's going to change.
It is.
So these are some things that Carrie has brought up, some things that she's run into. And, of course, I was working with our compliance team, with my agent resources team to figure out, like, hey, guys, what's some things that, like, nobody knows unless it happens to you?
Yeah.
You know?
My whole team, like, makes fun of me because they're like, if something weird has happened, it's going to happen to Carrie.
I used to work with an agent. She may be on today, Erin. And Erin I was working with her for a long time. And so she would just message me like, hey, I got another one for you. Because it was like, if it was
just
going to happen.
Weird one-off thing.
Weird one-off. So here's some of those some weird one-offs. But I would love to hear from you guys some more nuances that you've run into in addition to these. So the first one is something that is like, there's not a book that tells you is this a B medication or is a D medication, but we run into these all the time. And the one that I find really, really fascinating are like vaccinations.
Oh, yeah.
Like how almost all vaccinations, are going to be covered by B, which makes sense because they're administered in a doctor's office. Yeah. You have to go, through your primary or even through like a Walgreens to do it. Except for the shingles vaccine, which is administered the exact same way. Same process. It's everything, but it's a D vaccination.
And what's weird is I feel like I've had, I wish I would have remembered this or looked this up before. I even had some spouses who both got the shingles vaccine, and their shingles shots cost completely different. But I think shingles is a tier 3. Mm-hmm. They were on the same plan. They had met the deductibles. Like, it was just weird. Their shingles shots were different. So, like, maybe, like, one person had them hit the deductible and the other person... They had both already hit the deductible.
That's weird.
I want to say it was their second shot and one was their first, and maybe that differed? Mm-hmm. I don't remember.
That's just something to keep in mind. And I'll tell you this happens a lot. And I've seen this happen where it's, like, the pharmacy is being... maybe a little less honest or greedy.
Yeah, it could have totally been the pharmacy.
What
too.
I've seen happens a lot is actually diabetic medications, particularly when it's done through a pump. Because this is another thing that's really weird. Most of the time, diabetic medication is going to be Part D, unless it's administered through a pump.
Okay.
Then it's Medicare Part B because it's considered part of, it's how it's administered through the durable medical equipment, which is weird. The same medication is a B or a D. Again, goes against everything that we think. What I see a lot of pharmacies do, though, is that they will bill and say, like, oh, your Part D is not covering this. So they'll bill the person out of pocket. Then they will go ahead and file the claim correctly through Part B. So the pharmacy is getting paid twice. Now, again, I've been doing this for almost 10 years. I've only seen that happen a handful of times, but it is always, when I see a pharmacy double dipping, every time I see it, it's on the Part B and D medication stuff.
On the other side of that, speaking of diabetics, but then like their blood glucose meters.
Right.
And the Lancets and all that. That isn't D.
Right.
That's B.
Exactly.
So that makes it even more confusing. My favorite B or D nuance is a drug called Prolia.
Yes.
Do you know about Prolia?
I don't, but I think you were telling me about this.
It's for osteoporosis. I have probably 10 women clients who are on this. It's an injection through Part D. Roughly, it's like $1,500 twice a year. They go to their pharmacy and they get it injected there. About 2 years ago, I met with a physician who was a new client of mine, and his wife receives Prolia, and he gives it to her in office, fully covered under Part B, $0, because he administered it to her. So I started telling my other clients, hey, ask your primary care to give this to you in your office, $0 versus $1,500 twice a year at the pharmacy.
That's wild. But I mean, like,
isn't that crazy?
That makes sense. But again, that's like what these nuances are. If you have somebody that's paying that and it's technically is a Part D, go ahead and see, like, hey, there's things you can do for the medication to get that changed.
Right. Yeah.
Go
they
talk
saved
to your doctor.
$3,000.
That's insane.
And I asked my client, I said, if they run into any problems with their like primary care, can I send them to you? And he was like, of course.
Wow. Well, that's awesome.
Yeah.
That works. And again, it's just knowing what the tall tale saying that we tell our team.
99? Oh, that must have decreased.
Yeah. Humana told me Thursday would cost her $99 2 times a year.
Interesting.
And yeah.
Still, if they met their Part B deductible, would be $0, still be $200 cheaper. For the shingles vaccination, is there a copay, and does Part D cover both vaccinations for the shingles?
The copay is going to be based on what Part D plan you have.
Yep, it's based on the Part D.
And you said typically it's a Tier 3, the shingles vaccine.
Typically it's a Tier 3.
So most likely we'll have at least somewhat of a copay or co-insurance on it.
Yep. I'm trying to think, like that couple I met with, I think one paid like $47 and the other one paid like $150. Like it was significantly different.
Like a major difference.
It was bizarre. I'll have to remember.
Sounds
but
like,
yes, it's Plan D or Part D specific.
Yeah, depends on what plan they're on.
Yeah.
The next nuance that we wanted to talk about, and this was something we actually had a little bit of a conversation on a few weeks ago, but talking about short-term care facilities and long-term care facilities not wanting Medicare Advantage plans. In fact,
I still just don't understand this.
They call them internally replacement plans. And I think part of it is just our miseducation about those short-term care facility places. Keep in mind this typically like short-term care facilities are typically like in a wing of these nursing homes. I know like what you said where you were, it was like, no, this is just a rehabilitation center.
Yes. And that's what I'm trying to find, because I remember, I think I told you, I have been on a kind of like a post-acute care team as the insurance person with a bunch of administrators, nurses, and there was a couple physicians on there. And they just do not like Medicare Advantage. I swear they were trying to kick us out once they found out that we like could represent Medicare Advantage plans. But like, and I need to find the email, they're saying that these Medicare Advantage plans just will not cover the skilled rehab that they needed.
Right. Now, I do know, like, there's additional, like, they
Which
have
Part
to
A and
cover
B
it. Right.
should.
Right. It absolutely should. Part of it is, in my experience, is that some Medicare Advantage plans will have to you submit more, like, proof or have you submit more documentation about that. I've also seen, which isn't good, which isn't fair. I also know in a lot of those facilities, because it's really, you have to be really careful. Of course, they have like the 3 midnight stays.
Yep.
There's a lot leading up to a stay at a skilled nursing facility that needs to be accomplished prior to Medicare, like approving all the payment and stuff.
Right.
But I think a lot of it is too just misinformation when it comes to their billing department, because the same people who typically will do the billing for the short-term care facility will also be doing the long-term care and the nursing home stay. And so obviously we know Medicare does not cover long-term care, but it'll cover some things that you have happen during your long care stay.
Okay.
And so the billing, they try to bill them the same way, and the Medicare Advantage will be like, oh no, we're not going to do that because of, this, that, and the other. So it's not correct, but it does happen. It's something you hear nationwide. Skilled nursing facilities hate them.
There were even, I vividly remember one of the nurses says she has tried to take people off their Advantage plans. Like, she's taken them off of them when they're in skilled, so they just have A and B. Well, obviously they can't health qualify into a supplement.
Right.
Now I was like, okay, so now you just put no cap on their out-of-pocket costs.
Yeah.
How does that make sense?
It doesn't. And
they were like, well, at least they'll be able to receive the services. I was like, no, they could just pay out of pocket for them. Like, that would basically be the same thing.
Yeah. It genuinely is crazy. It's just so much bad information out there. And it happens a lot because they're the people who everybody goes to ask these questions.
Yes.
And they're getting those questions 50 times a day. So even if it happens with the amount of clients that they have, even if it happens one time per client and it's an easy fix, they're still hearing that hundreds of times.
So the other thing, not just skilled and short-term care. So my brother and sister-in-law and dad, actually, they're all physical therapists. And
wow.
They also
gotta fix my posture.
Strongly, I know. Me too. They also do not like Medicare Advantage plans because somebody will need, the doctor writes a script for 3 times a week for 6 weeks. And then they go through that, and then they realize, well, I really need more. But the Advantage plans won't approve more.
Because they already did, here's the script, this is what we're doing.
The doctor will write the script again, and they'll say, no, we're not paying for it.
It's a
How?
third.
If the doctor's saying that,
But it's the same thing that happens all the time. What is considered medically necessary? Like certain chemotherapy, whenever you take prescription drugs associated with nausea, sleep, things like that, most of those are not covered by Part D or Part B because it's not medically necessary.
The nausea meds aren't?
A lot. So nausea medications for, there's a specific type of, and it may be different now.
That.
There's a specific type of nausea medication that is supposed to go with chemotherapy, and it's actually done in vitro. And that is what Medicare will cover. So a lot of times anti-nausea medication that is prescribed is not covered by Part B, Part D. Because it's not considered medically necessary. There's a ton of different nuances like that. But again, 100% yes. Yeah. We do know that if you're working with the short-term care, and also keep in mind long-term care facilities, people who are on in a nursing home and they're on a Medicare Advantage, they'll try to get them moved ASAP as well. And a lot of the reason for that is that they try to get, if a person goes into a nursing home, the first thing that the nursing home tries to do is get them to qualify for Medicaid. So they will start going through everything and do whatever they can to get that person to qualify for Medicaid so that the state will come in and pay for the residential of that person being in the nursing home. And so you'll see a lot of times when people enter the nursing home, I've seen this a ton, where the husband and wife will get divorced. They'll put all the assets in the husband's or in the healthy party's name, and then put the person.
But how does that not fall under the 5-year look back?
Well, when it looks to Medicaid, it's not the 5-year. It's what is your, again, I have to, it's different.
But they look back 5 years to make sure that you didn't disperse your assets to your kids or something
I would have to double check that. Well, so it's a lot of it is, again, you do it via the estate. So if you do an estate versus, I'd have to look into it. But it happens all the time.
Wow, I never thought about a divorce. Well, but you couldn't prove, yeah, I wanted to divorce my husband.
I think a lot of it is they put, I don't know. I'd have to look at it. But there's something you put it in a certain type of estate that it takes the money to where Medicaid cannot go after that money. And you can do it while you're surviving, while you're alive. Well, I'll have to look into that. But yeah, it's crazy how those external facilities look at that.
Yeah.
The next nuance that we wanted to talk about was going to be, this is something we get all the time, and that's credible coverage.
Yeah.
What is credible for B is not credible for D and vice versa. For example, the biggest one...
In my opinion, it should be.
In everybody's opinion, it should be. It's crazy that it's
Yeah.
not. But talking about COBRA and VA, we know that COBRA, if somebody decides to stay on COBRA for and exhaust that benefit, they do not get an election to go into Part B.
Nope.
They do
Not
get an
credible.
election to go into Part D. They'll have the Part B late enrollment penalty, all of that stuff,
And
which
the
is
VA
crazy.
is opposite.
And no, the VA is the same. VA is not credible for Part B, is credible for
Oh,
Part
yes,
D.
I'm sorry. Yes.
No, you're
yes,
good.
Yes.
So and we see that happen a lot, that a person will go ahead, like, who is on VA benefits, they go to the VA, they were told to go to the VA.
Yep.
I have an uncle who goes to the VA, and, like, he actually has, like, retirement state insurance.
Oh, yeah.
But refuses to use them
use
because I went to war, I get VA benefits, that's what I'm going to use. It's like a pride thing.
Yeah.
So a lot of people will not take out Part B because they have VA. Well, something will happen. They want a second opinion. The hospitals are getting overrun, so they won't be able to go to more places. And Part B is they're having to pay that penalty now.
Did I tell you? So I've gotten to know, she's in the HR department at our local VA. And she said that they recommend, like, if they're ever asked, and they also have, like, signs at the VA, they recommend veterans is almost what I said.
VA-erins.
Veterans apply for Part B.
Mm-hmm.
And so I love that. I love that they're actually encouraging them to do that.
Well, and the thing is like now they're coming out with all these really awesome Medicare Advantage plans that are like the $0 premiums, but
those that are like hard to sell because they sound too good to be true.
Yeah, those but they have to have Part B to get them.
Yep.
So I'm glad. That's good to know that like they're saying no, like you should do this because again, like it's crazy that how many people are like, oh, I've had this for years. Why would I get Part B? Well, there's a lot of reasons why you would want to be able to see additional doctors to the VA.
Absolutely.
The next nuance we want to talk about is actually something that you were talking about.
Have you ever experienced
I've
this
never.
or
I've
looked at it?
You know what? I've looked at it, but not on the myssa.gov account.
We should have put a graphic on here. So I don't know if you guys have ever helped your clients with A and B or seen what it looks like to log into ssa.gov or to my SSA. There are 3 different logins. It says log in here, my.gov log in here. 3 different logins. And so the first one is the first one
bizarre.
you see.
Right.
And so most people will log into that one.
Right.
And it tells them their username and password isn't correct, that they've never logged in. And so it took me forever. It's if you created a Social Security account like prior to 2014 or something. I don't even remember the date. I've only had one client that section actually worked.
Weird.
And so the small blue button under here that says login.gov, you click on that button and then they can apply for their A and B. So like it's so backwards because the process is if you go to the Medicare drop down on ssa.gov and you hit the blue apply for Medicare now button and then it prompts you to create a Social Security account. You create that account, it sends you a code and all this stuff, asks you your questions, and then it makes you log back in. The page it takes you to is the wrong one. You have to go down below to the blue button that says login.gov. You have to skip I truly think it's to confuse people and make them call Social Security.
But that's so annoying because there's currently still an SCP going on because Social Security, and it's just for Part B enrollment, Part A and Part B enrollment, but because Social Security's phone lines are still crashing. Busy.
I swear it's because of online.
That's insane. And that's what's so frustrating.
It has to be the only reason.
Is that they say, like, go online to do this. And, like, you would think, like, again, like, going to mymedicare.gov. We did an episode on this before. It's like, when do you go to socialsecurity.gov versus when you go to mymedicare.gov account? Because it's not intuitive. It's not, like, an easy, like, you almost have to have a full roadmap to know how to work that website.
It took me probably 15 minutes to figure out what was going on. And I'm 31. Can you imagine, like, seniors who are not... Some of them are tech savvy, but, like, no.
Well, and, like, just the patience of it.
Oh,
you know what I mean? The patience of being, like... Because, again, like, I am, 30. I couldn't imagine trying to figure out what is going where and why and how. And, like, having the patience to do that versus being like, you know what, screw it.
Yeah.
Let me just call Social Security. Which is a crapshoot when you call Social Security.
And the username for one is, like, your email, and the username for another is, like, an actual username that you create. It's very confusing.
And again, like we've seen,
I think it's a terrible system.
Again, if you're interested in this, go back and watch a previous episode. But we talk about like when to use SSA.gov, when to use MyMedicare.gov, when to use these other platforms because it's not intuitive. So you never know.
Not at all.
Like again, to apply for Medicare, you do that at Social Security. You don't do that on Medicare. To look at like what your low income subsidy is, to look at like your plan, something like that, you go to Medicare. You don't go to your Social Security stuff. So it's just like it doesn't. Again, it's difficult for consumers.
1 + 1 equals fish.
1 + 1 will always equal fish. Oh, and we froze up there for a second.
We did.
That's okay.
And I realized we're back down here.
I miss us in the
Posture check.
Now that I know your family's full of physical therapists.
Oh, gosh.
The next thing is this is something that you really need
educate on this
to
one.
check your
I'm all ears on
contracts.
this.
You have to check your contracts. You don't know how many agents will come to our office or come to me and say, hey, like this is what I'm doing. I'm getting ready to sell my business, or I'm getting ready to buy a book of business. And you look at the contracts, you're like, you didn't buy anything or you didn't sell anything. And it's all because of where you have your commissions being paid to. So really you have two options. Either have your commissions paid to an entity like an LLC or an S Corp, or you have your commissions paid to your Social Security. When you have your commissions paid to your Social Security, it is almost impossible to move those commissions to anywhere else because they are tied to you. So that means that you have to keep your license up to date. You have to keep your certifications up to date in order to continue to receive those renewals and those commissions. Mm-hmm. So if you're individual and you say like, okay, I have my book of business, I'm going to sell it to Carrie. Mm-hmm. You can buy my brand, you can buy my website, but the carriers will say, well, no, we never agreed to that. These commissions are tied to this person with this license.
So what would happen? So like eventually, I imagine probably the next year or so, I'll get an LLC.
Yes.
So I'm not buying a book of business,
right.
But like I'm going to have an LLC.
So if you started off as an individual and then now you're incorporated or now you're an LLC, you will have, in the eyes of the carrier, 2 books of business. You will have one that's tied to your Social Security, and then anything you write going forward will be tied to your corporation or LLC.
Interesting.
So you'll receive 2 different 1099s or 2 different, whatever.
2 different ones.
You'll get 2
You
one
can't change the other?
So it depends on the carrier, and that's what I put on there, carriers don't care what your lawyer says. That's what we have all the time. Like, my lawyers looked this over. They said, here's the bill of agreement, and that doesn't matter. Some carriers, like United Healthcare, will do what's called a succession, which means that you can basically close out this writing number and succeed that to a different writing number, but you can only do that once. So if you do that to your current book of business, you wouldn't be able then to succeed that book of business to someone else. You can only do that once. So every carrier will have their different nuances.
That's crazy.
If you're with Mutual of Omaha and you're writing as an individual, that business is dying with you. You will not be able to move an individual.
So what do you do if you buy a book of business?
You call senior marketing specialists and pray, but you have to do your research ahead of time. Like I said,
what would happen if I buy a book of business and he or she's contracted with Mutual of Omaha? How am I going to get those
if they are contracted
commissions?
as an LLC or corporation, then you buy that tax ID number and you now own it, and you just do like a principal change. Depends on the carrier. With most carriers, if we're an LLC or an S Corp, it's like a principal change. It's like, okay, you bought this group. This group is not tied to this human. This group is tied to this tax ID number. Let's have you absorb the tax ID number. As an individual, if you're with Mutual of Omaha, SOL. There's nothing that can be done if you're buying it from an individual.
That's pretty crazy.
Other than just rewriting the business. You bought leads. You didn't buy business.
You just have to... Wow.
So again, it really pays attention if you're looking to sell or you're looking to buy business. Do your research and talk to us ahead of time. Yeah. Because and there's no set rules. It's every carrier will do something different. Like I said, United Healthcare is the easiest company. They do have a way, but you can only do it once. Mutual of Omaha, if it's a corporation or an LLC, you can go ahead and move it over. If they're not, you're done.
So me and like 3 other agents at SBS, we've been struggling with National General sending client policies to our personal home address. which is crazy.
Mm-hmm.
And we've been trying to fix it. I've been trying to fix it for like 2 years, and somehow like I randomly like it trickles in. I'm like, wow.
You always have to double
I get so
check.
stressed out because like my
Mhm.
daughter loves checking the mail, and she comes out with this big
Yeah.
white envelope, and I was like, Summer, give it to me. Don't touch that.
Well, you have to check too with that because like things like that will sometimes depend on like the upline. So there's some things like I
Yeah.
think like Mutual of Omaha with us, they just sound super not user friendly. They
Yeah.
are, but just like these little nuances, like is it Mutual? It's another long-term care company that either they all like depending on like us, senior marketing specialist, top of hierarchy. If we say those policies get sent to the policy owner and not the agent, then that's how it has to be for everybody in our downline. So if one
Okay.
person's like, "Ooh, I don't like that," then if then we would have to change it for anybody
Everybody.
who receives that.
Okay.
So it's just really, really interesting. Yeah, and Phyllis is saying, I'm in the process of moving my carrier appointments and commissions and bank departments to my LLC, so just keep in mind, you can change the bank information to where the commissions will go into an LLC account, but the
Okay.
ownership of that business
Okay.
remains where it was written.
Gotcha.
So again, if you ever want to sell, or like if something unexpectedly happens to you, and you are no longer, either you pass away or something happens, you're no longer able to recertify, or you're no longer able to keep your licensing in check. It's weird because companies will say like who owns the business versus who's getting paid on the business, and they are not the same thing. Agent of record and receiving commissions are not the same thing. So
Interesting.
even if you are an individual, you can move all the banking information to your
somebody
LLC,
else.
but anything you're writing as an individual, if you stop or something happens to your license, the commissions stop. Everything stops. So still make sure, like, yes, you can change the banking information what you want, but it's all about being able to service that business versus being paid commissions on that
Joe says, do you need a prior appointment based on by CMS rule for Part D, prescription drug insurance, and Medicare supplement? I'm not following that question.
I don't think I understand the question.
Yeah, I'm not sure I follow that question
Let me
either.
answer what I think you're asking. You can tell me if this is not what you're asking. You can sell a Medicare supplement and a prescription drug plan in the same appointment. You can sell all of them. You do need a scope of appointment before you discuss the Part D benefits, but you can sell a Medicare supplement and a Part D in the same appointment. Just make sure, again, if it's over the phone, that the call is recording. Anything that led to that Part D application, the chain of enrollment is documented. So yes, you can absolutely sell MedSup. MedSup is on the scope of appointment. So if you're doing a scope of appointment, you can absolutely do a MedSup in that same appointment. So
let us know if that wasn't your question.
yeah. But anyways, that's kind of, again, just double checking with your contracting. If you started out as an individual, but you were going to do an LLC or an S Corp, just make sure our team at Senior Marketing Specialists has an entire department dedicated to what we call book of business to help people move, like, hey, this is where you're at. We work a lot with people who are buying other agencies or selling their agencies, but a lot of like what we would call the internal shift as well. Just know that like your carriers don't care what your lawyer says.
Yeah.
It is a process. Phyllis says it's very time consuming. Phyllis, absolutely right. You have to recontract with all the carriers and you have to license your LLC because the carriers need to identify that is a licensed entity. It's just weird. I can't even describe all of the nuances on this channel, but yeah, it is a lot. And I think I have a couple more, and I want to get through them because it's already almost 10:30. This is something we've talked about a lot on the show. Every single prescription drug company, but any type of pharmaceutical company or prescriptions, they have to have coupons and they have to have programs that are qualified for either disease,
some types of assistance.
Exactly, either disease specific or income specific. They have to make those available. But they do not have to make it easy to find. A lot of these programs are going to be like on like back ends of the website.
Some of them are very hard to find.
Almost impossible.
Tiny print at the very bottom of their website. There's a small link on some of them. But even if they have some of those discount programs, a lot of times if you have a Part D, they're not valid to use.
You can't
with
use
it.
them with it, right? So like What I do is I recommend going to needymeds.org because needymeds.org, we've talked about it a ton on this channel, but it makes, like, it puts every single.
More familiar with
it's amazing. It's it looks archaic, I'll be honest.
I've been on there a few times and I need to just like really dive in.
It looks archaic, but it's pretty user friendly.
Yeah.
And I'm happy to do walkthroughs for anybody. But it's, you go in there, you can either type up the disease that they have or the prescription that they're on, and it'll bring up every single coupon and program that is available for that one, and then you can see, like, do they qualify for it. Now, a lot of them, if a person has a Part D plan, they can still use the program or use the card. They can't just, a lot of them won't let them use the Part D plan and the card. It's or. So they can have Part D, but not use Part D in this case. Other ones will say, like, if you qualify for Part D, you don't qualify for these programs. So, but it's good to know. All of them are different. So needymeds.org will help your clients a ton on prescription savings. And then the last one we have on here, the reason why I wanted to include it was because these rules are changing.
Yay!
And this is
something awesome that's happening.
Thank God. So we know that if somebody delayed or did not enroll into Part B for whatever reason and did not have another form of credible coverage, we know that currently messes up their Part B effective date. So we know the general enrollment period is from January 1st to March 31st with the July 1st effective date, which I don't understand.
Who made those rules? No. Never makes sense.
Or another thing that, like, is it's more common if, like, your Part B was supposed to be effective, November 1st, but you didn't enroll in it until October, then that means, like, even if you enrolled in it, like, at the end of November, it's still not going to start till, like, January. Like, if you delay it a month.
In your IEP,
your IEP.
Yep.
If you delay it a month, then it's going to delay, like, 2 more months. Yeah. So, like, you can end up, like, having your Part B delayed. Even if you enroll during your IEP, it can end up being, like, delayed, like, 3 or 4 months. So, starting January 1st, that rule does not exist. So, during the general enrollment period, during that one of those weird times, if you enroll in January, instead of having to wait till July 1st, it'll become available February 1st. So, it's now effective the following month, not that weird July 1st rule. So, it's a nuance because not a lot of people knew about it. However, you're not going to have to worry about that come January 1.
Another nuance that I just thought of as you were talking about effective dates is first of the month birthdays. Plans are effective first of the month before.
That is a nuance. That is a nuance. Yeah, January. Yeah, so, like, if your birthday was November 1st, then your Part A and Part B will be October 1st.
November 1st, and she just got her card, and it's 10/1 effective date.
Just effective dates in general. Like, if you are on low income subsidy, if you have ALS, you have to have ALS for 6 months before your Medicare starts. I think end-stage renal disease is also either 3 months or 6 months that you have to have it.
I think it's 3 months.
Is it 3 months that you have to have end-stage renal disease, and then your plan goes into effect? Whenever you get a kidney transplant after your end-stage renal disease, you get Medicare for 2 more years, and then you're done. And that's triggered by a kidney transplant.
What?
A successful kidney transplant. Yeah. So if
they kick you off?
They kick you off Medicare. After a successful kidney transplant, after 2 years, you no longer qualify for Medicare. The more you know. There's just, like, a lot of, like, weird things. It's like, oh, yeah, that's a thing that we have to worry about.
Joe said, in other words, you need a scope of appointment based on CMS rules on taking a Part D drug application by itself alone.
Yes. Yeah. Anytime you're selling Part D or Part C, scope of appointment. Every single time. If you're discussing the benefits, selling the benefits, anything like that, if you're discussing C or D, scope of appointment every time.
Andrew, it was needymeds.org.
Yes.
Needy, Needy.
Let me go back. I'll put it back on the screen.
Yeah, there we go.
Yeah, needymeds.org is that website. It's actually a subset of the website called BenefitsCheckup.org. BenefitsCheckup.org is a really cool website that does all things money saving. Like, doesn't matter your age, doesn't matter your income level. It'll do, like, what programs do you qualify as a human being? Like, for example, whenever I bought my first house when I was 22. I bought my first house when I was 22, and because of my age and I was a first-time home buyer, I went to Benefits Checkup and found out that I qualified for, like, a ton of assistance on, like, home updates and things like that.
That's awesome.
And that was just because of Benefits Checkup did that. So BenefitsCheckup.org, and then Needy Meds is the focus on that.
Love it.
Yes. So any other,
any other nuances that you guys have
we talked
run
about,
into?
I was asking, Dan Mangus, who is the Vice President of Growth and Development at Senior Marketing Specialist, he writes a book called Talking Medicare. So if you're interested in Talking Medicare, more than happy to send you a copy, but he writes it every single year, and they have everything to do with these nuances. So like if you're like, oh, this person has TRICARE for life and this, you just go to the book, type in TRICARE, and it pulls up every single resource that's going to help you with TRICARE. I'll send it to you.
Me, please.
There's stuff on there like, oh, this person has an HSA. They've had it for the last, 12 months. What does that mean? HSA is a whole nuance on its own.
Yeah.
The 6-month look back, things like that. So there is a book called Talking Medicare. If you're interested in Talking Medicare, text this line with your email address, and I will send you Talking Medicare. But I'll get you a line with that. But again, he's been writing it for, I think this is like the 5th edition
that's awesome.
of Talking Medicare, and he does it every year. So some of them like, oh, this link's no longer relevant. Let's take it out, or hey, this has changed. So it's really great content. But yeah, that's Talking Medicare by Dan Mangus. But again, it gets into all those little nuances.
Right up my alley.
Oh my God, I love it.
I already feel some Medicare Minutes videos.
That would honestly be great. Yeah. Great for so Carrie does this really cool. We'll tell them about Medicare Minute.
I do a video, try to do it every other week, that I post on LinkedIn and Facebook that they're just called Medicare Minutes. And I talk about, it's just me facing the camera, talking about different Medicare nuances, different Medicare. They're just solely educational. And I try to keep it under 60 seconds. And I love them.
That's so cool.
Yeah, I get lots of feedback from them.
So anyways, text us at this number below. That is my direct line. Give us a text, and I will be more than happy to send you the Talking Medicare book. Awesome. Well, thank you guys so much. And Brittany says, love the Medicare Minute. Thank you, Brittany.
Thanks.
I love that picture with the puppy. Awesome. Thank you guys so much. And I guess we'll see you next time. So until then, have fun.
Make money.
And give impeccable service. Thanks, guys.
Thanks.